So when I was in my first job as a doctor, I was working in a medical ward and I gave a patient an overdose of a drug called nettlymycin, which is potentially very toxic to patients' kidneys. And the patient did become very unwell and ended up in intensive care. The patient survived, but I felt terrible afterwards because of the mistake I'd made.
We come to work every day, head down, do our thing, go home, and we're stuck in a routine as clinicians, constantly doing the same thing day in, day out. Do we ever audit ourselves? No, we only audit ourselves when things go wrong.
We must first not do any harm, okay? And I think the risk for patients when they come to healthcare facilities or anywhere is in fact the risk that they are harmed.
The more I thought about it, especially now, I realised that it wasn't really all my fault, that the system had actually made it more likely that I would make a mistake. I was the clinical lead for a patient safety programme in Scotland which developed and tested approaches to improving safety in primary care, and that worked with about 70 practices, and then that was successfully evaluated because it led to a reduction in harm, improved practice systems, developing practice teamwork, and was then spread to all 1,000 practices in Scotland, and that's been running for the past 3 years.
I mean, this is well within the scope of primary care, right? We try to prevent things before they happen.
Having done it now for a couple of years, there is a security that we get from having best practice. I mean, it's a part of our job is that we're worrying about people, we're worrying about medical conditions, we're worrying about our incompetency, we're worrying about have we ordered the right tests, have we thought of the right diagnosis, and so we're constantly living under a strain of could we be making a mistake here?
Well, I think the message is that Safety and Practice program enables you to do something that you may have struggled to achieve.
We've really promoted the nursing side of the practice here, and I think that's where the future of general practice lies, to be honest.
There's been enormous changes in those 40 years, but I've been a practice nurse for 20 years, and even that's changed a lot from just doing as you're told by the doctor to now we've got nurses doing a lot of their own clinics.
It was a big job for us nurses. We had to look at the folder every day to make sure it's all, we get through to the patients their result for the day. But since we came to the new program, it's more challenge for us nurses, and we are confident that we're doing that in upskills for us as well, and then take the load from our doctors.
As a nurse, I feel like more valued now. So like I'm sure like my other colleagues feel the same. We're learning more, and we understand patients, how to treat patients better. We understand what each patient is going through, what's their problem.
The program actually allowed us an opportunity to actually think differently, look at things closely, and focus on a process.
I think the good thing is one of our GPs was finding that that he felt that he was the only GP that was doing this efficiently before we started the process, and having discussed it with him and getting some feedback, he says that he's noticed that there's been a big improvement in a lot of this, and it's really kind of relieving a lot of his burden.
We had to actually say in our cornerstone stuff, well, what are you doing? And we could actually say, though, we're actually doing, we've got the cervical smear management program under the Safety and Practice, and we've got medication reconciliation, and they're all quality improvement programs.
The Safety and Practice processes permeate through the practice, so it's kind of hard to say, well, it was this initiative or that initiative is now different because of Safety and Practice. And over a 3-year journey, you forget at which point something changed. But overall, I would say that the adherence to quality improvement processes is a lot stronger. The knowledge of how to undertake quality improvement processes is incredibly improved.
I just think it's really increased our team feeling here. The meetings have It's, instead of just clinical meetings being held just by doctors, we're doing it with nurses and also with reception staff. So it really just makes it a lot more clear for all of us if something's feeling a little bit like we need to be aware of it.
I think the results handling audit and the whole process has led to much better communication. I think it's also led to better trust.
Safety in Practice has brought our team together. We have a lot more meetings than we used to, and everybody comes to those meetings and is involved in the meetings. I think everybody feels they can contribute to anything they like, that they can bring up any problems that they're finding.
One of the key drivers for me in my whole of my medical practice has been to provide the best quality, and if I can see how to do something in a better way, then I want to be able to do it. And Safety in Practice has really given me a tool which I can take to practice easily enough and improve quality well, without me having to do all the hard work. There's been a lot of hard work done behind the scenes to get the programs in place and think about them, and it's just a matter of being open to change and open to inviting a new style of practice in. And as I say, utilising nurses, but you know, it works very well. It just is a quality improvement tool that fits very well within general practice.
I see this programme as having the potential to spread to all GP practices in New Zealand. I see the programme as having the potential to spread to all community pharmacies in New Zealand.
So our aim with Safety in Practice is to embed this into general practices and make it business as usual. So if we've got great systems, great processes, then we come to work, we're doing our, our results handling, medication reconciliation, and it's business as usual.
To all practices that have been involved in the programme, I congratulate you. You have made huge amounts of changes to your practice that will benefit your patients and your team. And to those practices that are thinking about embarking on this journey, I would say to you, give it a go. There is some work up front to make changes, but actually the rewards are enormous. And practices sometimes don't realise how far they've come in the journey of improvement. There's better teamwork, better culture, staff take on new roles, people get greater professional satisfaction. In the end of the day, you have the confidence that your systems are safe and reliable, and that's good for you and it's fantastic for your patients.